how does that plaque form? And it obviously stops the blood from flowing because it's narrowing?
Yes, absolutely.
Okay.
So the way it forms is really, it's a fatty buildup of cholesterol and also our inflammatory cells that are trying to get rid of the cholesterol, but however, our own body's cells can't get rid of it in the rate that it accumulates. And eventually, with time, it keeps growing and growing, and then eventually, it makes this lumen smaller, and you have less blood flow.
All right, and in that case right there, how bad is that situation? Is that dire?
Yes, so this is obstructive coronary disease. Sometimes you can have non-obstructive disease where the plaque is much smaller and it's evident, but it doesn't have a hemodynamic perturbation.
Okay.
So it doesn't
And what do
actually,
you mean by that, if you don't mind my asking?
Yeah, my apologies. So that means it doesn't actually stop blood flow from going forward.
Correct.
Yes, whereas this, it's big enough where we call this probably a significant 60% lesion. So this is enough to cause symptoms and even possibly under extreme stress, a heart attack.
So in that 60% that patient has, for example, what symptoms would they feel?
Sure. So in general, when you have a lack of blood flow to a muscle, the muscle cramps. In the heart, it's going to cause pain. That's going to cause that classic chest pain that's always described where substernal squeezing chest pain, because that muscle, the big muscle that pumps all the blood in our body, it doesn't have oxygen. So then it gets ischemic, which means lack of oxygen, and then it eventually has a lot of pain. If that lack of blood flow is maintained for a certain amount of time, eventually it can lead to cell death, and that's what a heart attack is.